I, Dr. P.C. Raka, consultant physician, Malvanagar, Jaipur, would like to share with you some of the key points a consultant should keep in mind while treating a jain patient or a jain saint. There should be a good communication. You should first find out the priorities, needs, necessity, limitations, and restrictions for as far as treatment is concerned from jain saint and jain patient. We should be very sensitive about the culture of the Jainism, how to sit, whether the light or torch is allowed, whether you can use any electric equipment over the saint, over the patient. You should know these are some of the cultural key points you should keep in mind while treating a Jain patient or Jain saint. You should have good collaboration with the Jain leaders before you go to Sthanak to see the patient. Whether there is a priority of male doctor should see male patient, male saint, female doctor should see female saint, or there is no restriction. You should discuss with the leaders and then only you should proceed for treatment. Respect for ahimsa is very important. When you prescribe, there should not be any medicine which contains any non-vegetarian element or drug, because it is not acceptable by the Jain saints and even many of the Jain patients. Jain saints and Jain patients have very specific inclination towards diet. They prefer absolute vegetarian diet, so you should ask what they can take. Even many of the Jain saints do not take any of the plant which grows under the earth, like potato, like carrot, like onion, like garlic. So you should ask before you suggest diet to the Jain saint or Jain patient what are their preferences. Then practice should be quite ethical because they take very minimal medicine. So we should follow all the principles of ethics before prescribing medicine to the Jain patient or before treatment to the Jain saints. There should be a minimalistic approach because many a times they avoid repeated consultation from the doctor. So we should try to compile, consolidate and make comprehensive prescription so that there is a minimal, trauma or insult induced to the saints and patients while treating. We should have all the spiritual support to the Jain saint. They should be allowed their routine prayers. They should be allowed their routine vyakhyan and other activities they are doing, because they have to take hard fastings after your consultation, after treatment, against the perceived violence, perceived hinsa, perceived any of the key point addressed adversely during the treatment to Jain patient and Jain saints. So, keeping in mind all these key points, a doctor while treating Jain saint or Jain patient, he should keep in mind that he is no more giving any insult to his, faith, his trust in Jainism. Thank you very much.